We're going to get started. Let's see. Okay. Okay. Thanks for being here today. Appreciate it. Today we have our guest speaker, Eric Vickery. So I'm excited to have him here with us. I had the opportunity to work with him as a consultant when I was own my own dental practice. And that's one of the things that I would recommend to anybody in dental practice. I think you should always have a coach or somebody that you're working with throughout your life. I think even if you don't own a dental practice, you should probably have a coach to just kind of help you kind of set goals and continue moving throughout life. Eric began working in the dental field in 1998 when he started working in his first dental practice. And in 2001, he began coaching and consulting in dental practices. He has consulted for over 250 dental offices and has helped many offices kind of grow in their practices. One of his kind of areas of not expertise, but I guess we could say expertise, is he helps practices improve their practice monitoring systems. He's kind of an expert on case acceptance, verbal skills, and the DISC personality profile. He has a passion for stopping cancellations, handling patient objections, and asking patients for referrals and reviews. Further, he has a vast experience in financial arrangements, third-party financing, and eliminating dependency on insurance. So there's a variety of topics that we could have had Eric come and talk to us today about, but the one that I wanted him to talk to you guys about is called the case presentation tool. If you go onto Blackboard, underneath of our folder for this week, there's a handout that you might want to pull up and take some notes on as he kind of goes through and guides you how to use that with your patients when you're talking to them about treatment. So if you guys could welcome Eric here today, I would appreciate it. Thank you.
Hey guys. Thank you for having me, Dr. Harrison. I appreciate it. I love speaking to you guys every year. It's a nice change of pace for me. And I appreciate the introduction and seeing the future of dentistry. So are you all seniors? Oh, that's exciting. That's exciting. The countdown has begun. All right. So yeah, I'm president of All Star Dental Academy. And we do coaching division, and we do coaching dental offices. You know, we're coaching over 100 dental offices right now across North America, including Canada, because, you know, dentistry is very focused on teeth, which is essential to your success. That's your foundation. What we coach is being focused on people in your business and how to be relational. You'll learn at some point there's not a tooth that just walks the door. It's a person there. And how to talk to them first is going to be essential to your success. How to be relational. You're in the tooth industry, but you're in the relationship business. So today we're going to talk about case acceptance, just like we do with all of our clients at All Star Dental Academy. And you'll get a head start. You'll hopefully have some advantage here. How many of you got into dentistry because you thought, you know what, I'm a great salesperson, so why not sell teeth? Anybody do that? Is that why you're all here? No. Okay. I never get anybody to raise their hand on that. How many of you are excited to sell dentistry? You think, man, I'm going to be a great salesman when it comes to selling dentistry. Okay. I never get anybody to raise their hand on that. Sometimes there's like one or two people. How many of you hate the word sell? And I usually get a lot more hands than that. Yeah, congratulations. You're about to embark on selling for the rest of your career. Here's the funny thing. I'm the bearer of bad news to some of you. There is no profession where selling doesn't exist. The artist, you know, drew the painting, they got to sell the artwork at some point. The pharmacist sells the pills at some point. Even the pastor up front preaching is selling an idea, a concept. And the sooner you get comfortable with the fact that being relational with people and having them buy and spend money with you is okay, the easier it will be. Now, what I don't like is pressure sales. I don't like car salesmen pressuring me into doing something. Many of you could probably relate to that. I don't think anybody wants to be in a position where they pressure someone into buy something. So how do we do this in a way that is relational then? How do we sell in a relational way? My first mentor, and I totally agree with Dr. Harrison, you got to have somebody in your life who's a mentor to you. You got all the time, always have a coach or a mentor in your life in some aspect. Now, my first mentor, Walter Haley, said, if you don't like the S word sell, get used to the B word broke. And a little harsh, but I get what he's saying. And I think for me, it was, I got to sell in a way that's comfortable for the person I'm talking to first, and then me secondary. I got to be comfortable with this, and I don't want them to be uncomfortable at all. Is that fair, guys? Okay. So today I want to talk to you about the different ways that you can do this without feeling like you're pressuring people. Nobody likes that. So there's this theory about push purchasing or pull purchasing in your life. Every time you make a purchase in your life, paying for dental school, it's either a push or a pull. You've chosen to invest in yourself. It's a pull. You wanted to do that. Unless somebody told you you needed to do it and you had to do it or else, right? That's a need or a push purchase. So a push purchase is need, synonymous with need. You need to pay the bills. You need to go grocery shopping. You need gas for your car. That's a life thrust upon you, a need. A pull purchase is choosing it in your life. I want to go on vacation, right? Most patients don't wake up in the morning and say, what am I going to do today? You know what? I want to go get a crown today. They don't pull it into their life. It's a situation that is thrust upon them. And for a group of us in dentistry, like Dr. Harrison said, I've probably coached the neighborhood of 300 plus dental offices in 20 plus years. As a group, we don't like telling people, that we're going to force them to do something, to push something in their life. And yet, the number one most common sentence I hear in a dental office is, you need a crown. And here's this push purchase. Here's this selling technique that we just said we don't want to do. We have to get rid of that word need. Well, how do you do that? How do you get to a place where they want to do it? You have to develop relationship with them. So I will share my screen today, if that's okay. Let's see if this works. And you should be able to see my screen there. And I'm not going to go through the whole PowerPoint with you. I'm just going to give you a few tokens today to get you started. And I'm not even going to run it as PowerPoint. I'm just going to click through back and forth and show you a couple different things on my screen. Hopefully you take notes today and you're not just writing down your grocery list. Hopefully you're writing down some things you want to do. Being that you've been at school, you've probably raise your hand if you've heard the saying, knowledge is power. You guys have heard that while you've been at school, knowledge is power? Okay. You guys agree with that? Do you think that's true? Not sure, right? Knowledge is power if you do something with it, right? If there's action. When to make the information you're learning useless, don't do anything about it, right? Put this to action. So right now, if you're practicing, you probably have patients that just follow along with what the doctor says because maybe they don't have to pay for it. It's not much of an investment. As soon as people start having to pay for something, buying, the conversation has to change. And so there are two main factors to get away from need. You need a crown, push purchasing, and into pull purchasing. The two main factors are, number one, people buy for their reasons, not your reasons. Gosh, I don't know, Dr. Harrison, 15 plus years ago, we were working together. I don't know how long ago it was, but we talked about the emotional exam, finding out why people want to buy. Why are they there? People will come to you and they'll say, don't find anything today, doc. I just want a cleaning. Do I really need this? It's not bothering me. I'm going to go ahead and wait. These are the things that you're going to hear. And I'm guessing a lot of you went to school to help people. You want to get them healthier. That's the goal of all of this, is to figure out, how do I get people healthy without pressuring them? The first thing you have to do is relational. You have to understand why they're there. In other words, what do they want for the health and appearance of their smile, and why? Have any of you, raise your hand if you've heard of Simon Sinek, Discover the Why? Start with why. Anybody read that? Okay, good. 10 points if you raised your hand. That's awesome. You're ahead of the curve. You're going to want to write down your points today. If I hand out points, you're going to want to keep them and put them in your digital wallet. Okay. They're a lot like Bitcoin. You're not going to spend them. Don't think about spending the points I give you today. You'll just save them. All right. So people buy for their reasons, not your reasons. So before you ever do an exam and look in their mouth, you have to be able to have a conversation with them about how to find their why. What do you want and why do you want that? And what you're going to hear from your patients are things like, I want to have a confident smile. I don't want to lose my teeth like my grandfather did. I've got a job interview coming up. I had one older gentleman say to me, I don't want to be called Grandpa Browntooth. There's emotion attached to this. People buy with emotion and justify with logic. So it's an emotional reason that they're doing this. Does this make sense so far to you guys when I'm communicating with you? Okay, this is a preclinical conversation that you would have with them. Then you would do the exam and you would cover reason number 2, how to get out of push purchase into pull purchasing. People don't buy a solution to a problem they don't perceive to have. Well, it's not bothering me. I'm going to go ahead and wait. No pain, no problem, no pay. You're going to run into this as a business owner. It's going to frustrate you and you're going to wonder, why aren't they moving forward what we're talking about? So let's talk about this one first. And you got to realize you got to get away from telling people what they need. Well, you need 4 quads of scaling. You need 3 crowns on the upper right. You need 2 restorations, composite fillings on the lower left. Go up front and see Becky. She'll get you scheduled and go over the financial arrangements with you. You got to get away from this because, again, it's push purchasing. People don't want to be told what they need. Think about it this way. Have you ever, think back to when you were living at home, if you're not living at home anymore, and you probably still have residence there at this point, but you're 16, 17, 18 years old and your parents are telling you things like, you need to do your homework, you need to clean your room, you need to take out the trash, and how that made you feel, right? People don't like to be told what they need to do. So we've got to get away from telling people they need a crown, they need 4 quads of scaling. And so the rule is, it's the 95-5 rule. And what it is you're going to focus 95% of your conversation, a vast majority of your conversation, in the conditions section, and only 5% treatment. So I want to show you a different screen. That's why I didn't want to run the PowerPoint. So in the case presentation formula, this is something I wrote back in 2007 with a couple mentors of mine. And what we're talking about is the 95-5 rule, just like this. 95% of your energy and focus and conversation is built around the condition and the consequences of that. So when you're doing your exams, the patient is not hearing things like crown buildup, crown lengthening. Why do you think during your exam you don't want to focus on the 5%, the treatment, using words like crown? Why do you think that would be? I'm going to stop share real quick. Why do you think, let me ask it this way. What do you think patients think of right away when they hear a doctor talking about a crown? Money. 10 points if you said money. Yeah, money. That's a distraction for them. That's an immediate objection that you're creating in the way you communicate. They're not marinating in the diagnosis. You've probably been told before you can prescribe, you must first diagnose. Is that something you've heard? Okay. It's same is true for the patient. Before they'll ever spend money with you, before they ever buy a prescription from you, they have to be able to diagnose with you. Willow's heard this before, and she is not like, she's like, Dad, I could teach this by now. I got to get out of here. Her and I probably talk about this about 5 times a day. So, and Winnie's zonked out over here, her boxer friend. So here's the thing I want you to walk away with in this section of what we're talking about, 95-5 rule. When you're conversing with your assistant, when you're talking with them, you're diagnosing first. Before you can prescribe, you must first diagnose, and the patient is diagnosing along with you. You've heard co-diagnosis before. Well, to do that, they got to be able to understand what you're communicating about. Saying number 2 has an MODL amalgam with defective margins and a class 5 buckle with a furcation and there's wear facets doesn't mean anything to them. But when you communicate in a way that they can diagnose with you, I'm concerned about the large metal filling in here. There's a gap, there's decay underneath it. Has this tooth start to hurt you yet? When you start communicating that way, they co-diagnose and they go, oh, well, what do I got to do to fix it? You move out of you need a crown into what do I got to do to fix it? I want a solution. This making sense so far? Okay, good. Let me go back to sharing the screen. So I want you guys really to think about when you're communicating with your patients of spending time in here talking about conditions and not even getting to treatment until it makes sense to do so, which I'm going to explain. especially scaring them away with words like crown or EXT for extraction or things like this that get them totally distracted on money and all the wrong things. I want them diagnosing. Remember, I'll go back up. People don't buy a solution, a crown, to a problem they don't perceive to have. Most non-dental human beings believe that a crown is necessary once the tooth hurts. That's why they call up and they ask your admin person, how much is a crown? Because they're having a toothache and they're self-diagnosing and they don't understand that a root canal would be required now. When you're presenting and your patient says to your admin team member, you know what, it's not bothering me, I'm going to go ahead and wait. Or this is a famous line that your admin people will hear when they're, quote, confirming, which we don't use that word anymore, confirming appointments. Oh, I'm so glad you called. I was just getting ready to call you. You know what? That tooth, it's not even bothering me. I'm going to go ahead and wait. You can write that down. And you can take it to the bank that the reason they're saying that to your admin team members is because chairside, this did not occur. So we're not going to cross this line of talking about treatment until it makes sense to do so. So case presentation formula is going to take two things into consideration. I think this is just a better visual, okay? It's going to take into consideration their why, which you would have a conversation with them pre-clinically, understanding what's important to them. So I might say to Ricky Bobby, our patient, I'll say, Ricky Bobby, you know, earlier you stated it was really important for you to have peace of mind knowing you weren't going to lose your teeth like your grandfather did. And what does Ricky Bobby always respond with? Shake and bake. Then you say, I'm going to connect that now to what you've heard during the condition, during the exam, the condition. I'm concerned about the level of infection that's going on in your gums, the gum tissue. I'm concerned about the decay that's going on in those two teeth in the upper right. Now, the reason this is not a surprise for them when it's time for you to present is because during the exam, they've been listening to you and your assistant talk. They've been marinating in condition and co-diagnosis. They've seen intraoral photos. You've pointed things out to them so that they can diagnose with you. If they don't understand what it is you're talking about, they will not make a decision. People would rather risk making no decision than risk making one they don't understand. They'll say things like, oh, I need to think about it. I'm going to go home and talk to my spouse. And you won't get to do the dentistry you want to do. We have an opportunity in dentistry to make a great living, that's awesome. You have a lot of debt to pay for now, starting next year. Okay. And you'll have a business to take care of. You'll be running a business. Every business needs three people: an entrepreneur, a leader, and an artist to make a successful business. You will be all three. You right now, you're learning how to be the artist. You'll need to learn how to be an entrepreneur. How do you talk to people? How do you connect with them? How do you grow your business? At the end of the day, the reason dentistry is so great is we get to get people to a place of health. We get to move them to a place of health. And if you don't get to do that because we don't know how to communicate with them, they don't say yes, right? Then you don't get to do what you want to do, which is getting people healthy, and you don't get to be in business. 9 out of 10 small businesses fail in the first 10 years. Now, I don't say that to scare you. That's not the same statistic in dentistry. That's because a lot of people go out there and they think, oh, I'm going to go start a business. And they go start a mom and pop shop or whatever it is, a restaurant, something on Etsy. And about year 10, it's faded. It's gone. You don't have that option. That will not be an option for you. Some of you will go out and be associates first. You get your feet wet. You'll go out and practice as an associate, which is highly intelligent option to do. You'll make a very good living to pay off some debt. And then at some point you'll say, you know what? I want to make my own decisions. Entrepreneur, leader, business owner. And you'll want to make that decision. In order to do that, now all the risk will be on you. You'll have to lead a team. You'll have to know how to talk with them, and you'll have to be able to talk with patients. So practice management is a very broad subject. But those of us who are on this side of school, I went to college, got a business degree, and I can tell you that I learned a very, very small fraction of what I needed to know in school. It was just enough to get me going. And what I've learned and trained people over the last 20 plus years is we're still learning. We're still trying to figure out how to make it work and make it easier. There are no silver bullets. It just takes hard work and energy and effort, and it takes communication. So your communication style with your team or with your patients is going to be key. Your patient has to hear the diagnosis. No surprises. They're going to hear concern in that 95-5 rule. 95% of your time and energy is going to be focused on the condition. So let them hear things like, I'm concerned about the decay. I'm concerned about where this decay is under this metal filling. Ask them what we call implication questions. You imply something when you ask, like, are you going to eat that? That's the most popular implication question, but not in the dental world. You're going to say things like, has this tooth started to hurt you yet? Have you ever had a toothache before? Have you ever heard of a root canal? How long have you had this infection in your gums? How long have your teeth been bleeding? You're going to imply something instead of telling somebody. You're going to avoid the word needs. This will give you a huge advantage of people connecting with you and understanding what you're talking about instead of feeling like you're selling them. Does this make sense so far, guys? Okay, yes, good. Any questions, by the way, feel free just to jump in. All right, let's go back to sharing the screen. So when I connect this preclinical conversation, emotional exam, they've shared with me what's important to them. Confidence, whatever it might be. Earlier, you said it was really important for you to have peace of mind. As you heard during the exam, I'm concerned about the two teeth in the upper right with the old metal fillings. We have them on the screen here. They're broken down. There's decay underneath it. We're catching this before it's turned into a toothache. That's the reason I'm so concerned about this, is trying to figure out how to help you prevent this from turning into a toothache. Do you know anybody who's ever had to have a root canal before? That's an implication question. Okay. Now, in order to figure out, can I move from talking about the condition to talking about treatment, I have to ask them two questions. They go something like this. I'm not trying to script you, but I'm giving you a concept of direction. I'd say, how concerned are you with these two teeth and preventing them from turning into a toothache? How concerned are you with these two cavities? Now, if they say, yeah, I'm not really worried about it, it's not bothering me, I didn't do a very good job up here then. And I have a choice. I can either give up. Actually, I have three choices. I could give up, I could push through, or I could go back. Well, you're not concerned about it. When it turns into a toothache, give us a call. We'll do a root canal for you, and we'll see you then. You could push through and say, oh, you're not concerned about it? Well, let me talk to you about a crown. Or you could go back and realize, where did I lose them during the co-diagnosis? Most of the time, if you're doing this really well, if you're doing this first half really well, and you ask them, how concerned are you with this infection in your gums? How concerned are you with the cavities in your teeth? How concerned are you with this space right here that's causing the other teeth to shift? How concerned are you with stopping this from causing you to break a tooth or a toothache? Most of the time they say, yeah, I'm concerned about it. The reason I highlighted how is because it's an open-ended question. Not, are you concerned? Yeah, I'm concerned about it. They can lie to you in one word. You'll hear from administrative team members all the time. Not all the time, but they can resonate with this. And they say things like, that patient said yes, they scheduled it, but they didn't show up. Or it just didn't feel right when they left. I really don't feel like they're on board. Have any of you in your practicing dentistry, have you ever had a patient not show up before? I'm just curious if patients don't show up. Yeah, okay. Is that frustrating? Yeah. Imagine if they have to pay for it and they don't believe it's a problem. They really don't show up then. So our goal is to get people to show up to get healthy. And so instead of saying, is this a concern for you? Yeah. Right? Maybe they're saying yes, maybe they're not. How concerned are you with this? Yeah, it makes a lot of sense. I'm really concerned about it. You'll have a better idea of, okay, I can move forward. So then wouldn't it make sense for us to talk about a plan on how we can take care of this? Oh yeah, absolutely. Now you're moving that line out of the way. This line between the fives, that's a barrier saying, do not cross this line, right? In the slide, it said, do not cross this line. Now you can talk about treatment. And I'll come back to this in a moment. Once you talk about treatment, you don't spend a lot of time here because it just starts sounding expensive. It gets very distracting. You focus on the condition and the consequences. Once you've done this, talk about treatment, then you can ask them, how do you feel about moving forward with this? Now, I want to talk to you about this question, and I want to talk to you about how to talk about the 5%. That first mentor I mentioned before, Walter, you probably heard, whether it's The Office, ABC's a closing, always be closing. Walter would talk about closing and things like that. And it really became a negative connotation of pressure sales. And so we got rid of that terminology of closing, but really what it's about is mutual agreement. And so when we ask questions, we can see, are we getting mutual agreement? So gone are the days of saying things like, do you see any good reason why you wouldn't want to go ahead and get these 2 teeth crowned? It just sounds like you're selling and trying to close. Instead, if you notice what I did there is I used the word how again. How do you feel about moving forward with this plan? Now you're going to hear some no's, and that's okay. You're going to hear some no's, and that's okay. You're going to learn from that. Not everybody's going to say yes, especially if you're doing ideal treatment planning, comprehensive dentistry. It's easy to solve toothaches when people are coming to you out of push purchase and hey, I need you to get me out of pain. That's easy. It's when there isn't pain that it's hard. And how you communicate will make the difference. So you'll ask them a nice, broad, soft, open-ended question like that. How do you feel about moving forward with this plan? Oh yeah, it makes sense. Makes sense. Okay. Well, why don't we go up front and see Virginia, and we'll talk to her about getting you scheduled and go over the financials. If this plan works for you, how's that sound? Yeah, good. Okay. Now you have something that you're moving forward with. If you don't ask, it's a no. If you know what happens when you assume. I won't get into that. So a lot of times this is what I hear dentists say. All right, well, you're all set. Go up front and see Virginia. She'll get you scheduled for that crown. They have no idea why or what it's about, and you have no idea if they're in on it. This is where cancellations come from. This is where they're born. I should say this is where they're conceived. They're born when they don't show up. So you have to ask questions. You have to be in a position where you can ask and move through a process with them. So you could say something like this. How do you feel about moving forward with this plan? Well, how much is it going to cost? Oh, that's a great question, and it makes sense. By the way, if you ever wanted to buy something, don't you think you'd look at the price tag, guys? That's normal. So when someone asks how much it's going to cost, that's okay. Don't be afraid of that question. Don't worry about not engaging in it. You might not get into the price discussion, but don't be afraid of it. You might say something like this. You might say, Ricky Bobby, I get it. I'm so glad to hear you say that. Virginia up front, she is amazing at figuring out your insurance and how to make this affordable and how to fit it into a budget if you want. Let's assume that she could do that part really well. What you and I have to be clear on is this the plan that you would like to move forward with this? Is this really something you feel like is right for you? If we can get that part worked out, is this the right plan? Okay, great. Let's go up and see Virginia. Okay. Again, asking questions, getting clarity, but you're moving from a very soft, how do you feel about doing this? Okay. Cost. If we work that out, okay. How much sense would it make to go up front and get this scheduled then? Yeah. All right, great. Let's go do that. You're asking questions continuously. Please don't create bad habits where you say things like, all right, you're all set. We'll see you next time. There's no agreement there. Anybody ever have their parent, right? You ask them why you had to do something and they said, because I said so. Has anybody ever had that happen growing up? Yeah, I see some heads nodding. Because I said so. I also had, don't make me pull this car over. That was another favorite one in our family. And I'll give you something to cry about. So do me a favor. Don't be like that when you present your dentistry, when you're talking with your patients, because I said so dentistry. It's not going to work very well. It's going to make your patients feel just like you did as a kid, because I said so. They need to understand why it's important to do this, condition and consequences. They need to understand that it's for their reasons, not your reasons. Am I making this clear, guys? Okay, loud and clear. Awesome. So I said I would talk to you about treatment. Do me a favor. When you start to describe what you're going to do for the treatment plan, please don't lead with the expensive terms. So we're going to do 2 crowns in the upper right there, and what we're going to do is blah, blah, blah. Don't do that. Because as soon as they hear the word crown, boom, they're back to thinking about the things we don't want them distracted with. Instead, say crown at the end and use, that's the term, use the definition first. So what we're going to do is we're going to make sure you're numb, you don't feel anything. We're going to remove all the decay from those 2 teeth. We're going to remove the metal filling that's up there that's causing this gap between the teeth, right? We're going to remove all the fracture lines. Instead of putting a metal filling back in there, we're going to put a bonded restoration, and we take the fibers of the restoration, the fibers of your tooth, and we connect those. So there's no decay getting in between there now. And that's going to be in the center of your tooth. Now, so the tooth doesn't open wide up like that, we're going to put a protective coating on the outside and hold it together. So every time you chew on there, nothing breaks, nothing fractures. Does that make sense? Okay, great. We call that a buildup and a crown. How do you feel about moving forward with this plan? You can see how I put the definition first and the term second. That will keep them focusing on the conversation. When my wife says, hey, we're going to have salad tonight, she loses me. I'm out. But if she says, hey, I'm going to grill some chicken or steak and I'm going to put that on some green stuff. We call that a salad, right? Then I'm in. So give them the good stuff first, right? Give the conversation piece first and then the term later. All right. So let me go back to the screen and I'll do this from start to finish so you can just hear how this sounds when you're talking with a patient. Now, you've done a lot of groundwork. Keep in mind, most of my clients hear this about 9 or 10 hours into training. You guys are hearing this in hour 1. There's a lot of things that go behind the scenes here. But I want you to understand this. Earlier, Ricky Bobby, earlier you shared with me is really important for you just to maintain your healthy smile. You like the way it looks and you want to keep it that way. As you heard during the exam, I'm concerned about the infection beneath the gum line that you can't see. I'm concerned about the decay that's in several teeth that you can't see or feel yet. The reason I'm so concerned about those things is, well, number one, with the infection in your gums, as we showed you on the screen, it's the number one reason people lose their teeth. Have you ever known someone who's lost their teeth? Yeah. Have you ever seen anybody who has really long teeth, black spaces in between their teeth? Yeah. Okay. That's like on a scale of 1 to 10, with 10 being tooth loss, they're like a 7 or an 8. Right now, you're a 4 or a 5. Now, I can't make you a 1 or a 2, but I can stop you from being a 7 or 8 if we do something about the infection in your gums, if you let me help you with that, okay? The reason I'm concerned about the decay in your teeth is because that's the other way people lose their teeth, or they end up with a toothache. You see, people come to us all the time that haven't seen the dentist in a while with massive toothaches, and they think, oh, I need to get this taken care of now. They don't realize all the steps that either could have been done to prevent it and save them money and pain, or what they got to do now to get out of pain and the cost of that. Things like a root canal. Those are the things that we want to avoid. So how concerned are you with preventing this infection from causing you to lose your teeth? And how concerned are you with the decay, these cavities, from causing you to have a toothache? Oh yeah, I'm really concerned about it. Okay, well, wouldn't it make sense then for us to talk about a plan and how we can take care of this? Yeah, great. Okay, so here's what we would do. We would have you see the hygienist for periodontal therapy. That's a fancy word for gum therapy, where we treat the infection beneath your gums. Allows you to save your teeth. You'll see her every 3 months for the rest of your life to help you maintain it so it doesn't come back, instead of every 6 months for a cleaning. That's the only way to get rid of this infection. It's a real agreement. It's a real serious agreement that we take very serious, and our patients do too. About 30 to 40% of our patients come to see us in that same format, okay? The second thing we're going to do is we're going to take care of the decay, the fractures, the crowns, the decay, the old metal fillings, the fractures that are in your teeth, and we're going to build them up, make them stronger. We're going to protect them. Those are called crowns, okay? How do you feel about moving forward with this plan? And then the questions will ensue. And once the questions ensue, you engage at a level, other than maybe the money thing, but you engage in that conversation. You speak in layman terms and you explain to them. Don't use the fancy talk. They won't get it. They won't understand it. Does this make sense, guys? Okay. This is called framing, or teaching people how to treat you, or for the fancy people in the audience, NLP, neuro-linguistic programming. It's a way to communicate. You guys all use that in your conversations. You've heard it your whole life. People who say things like, somebody spills milk on the table. What's the matter with you, kid? That's programming. There's something other than the words being used that are being communicated. So when you're communicating to your patients, you're actually communicating more than just the words you use. What's coming if they don't do anything? Focusing on the things you want them to focus on, not what you don't want them to focus on, because that will distract them and cause them to not get healthy. So make sure that when you go out there in the real world with practicing, that you get away from things like you need a crown, that you get focused in on what's important to the patient and connecting that to the condition in their mouth. So you're welcome to email me, eric@allstardentalacademy.com. You can go to allstardentalacademy.com and sign up for free webinars, things like that, where we talk about all sorts of stuff like this. One of my passions is helping people get healthy, which makes a practice healthy. When your patients are healthy, your practice is healthy. And the only way to get there is through good communication. So, Dr. Harrison, do they have that handout, the case presentation formula?
Eric, they do have that handout.
Love it.
Yeah.
Okay.
Yeah. Use
that. And if you have questions, you're welcome to email me. If you want to set up a meeting with me, we'll figure out a way to do that. Figure out how to talk again. As you're looking at a practice to buy a practice, I help associates all the time evaluate practice purchases. What's good about this practice you think about buying and what's not good. One of my passions is helping dentists understand the business side of things, like participating or not participating. So have they done any nachos yet? Has Nachos guy been here?
No, we haven't had Paul Goodman in yet.
Okay. All right. I won't steal his thunder. So here's the thing. Don't be mistaken to think that you need to participate with insurances to get patients. Some of you believe that you have to participate and be in network with dentistry. I help more offices get out of network on a regular, that's probably the number one chief complaint I get from dentists is, how do I get out of network with insurance? And I help them figure out how to do that after 10 to 20 years of being in practice, losing millions and millions of dollars and struggling to make ends meet at the end of the month because they're giving up 42% of their fees to insurance companies. You do not have to be in network with insurance for the insurance check to come to you and for them to pay your entire fee. Do not be fooled. Okay, I'm starting to get on a soapbox. You want to charge $120 for a pro fee and the insurance company wants you to be in network, they're going to tell you your fee's $67 and you got to write off the rest. Or you could be at a network, bill the insurance company, and they're going to pay you $120 and your patient still pays nothing and you write off nothing. I can't make it more simple than that for you. Hopefully I'm not offending any sponsors.
Eric, I have a question for you. And maybe we have questions in the audience.
Sure.
So let's go back. How do you overcome when somebody has a financial concern? Like what would that conversation look like to the person that is objecting? I think that would be helpful for the students.
Sure. Yeah. First of all, understand this. If you need to hang a picture on the wall, but you don't have a drill to make a hole in the wall, you're going to go to Ace Hardware and you're going to buy a drill. My question for you is, when I go to Ace Hardware to buy the drill and I spend $100, what did I buy? What did I get for my $100? Some of you would say, oh, a drill. Okay, it's deeper than that. Some of you would even say a hole in the wall. Okay, that's good. Others would recognize that you get something when you see the art. I'm actually buying what I feel like when I see it. That's what I'm spending the $100 on. So when I talk about finding the why being so essential, it's because of what Dr. Harrison just asked me. Why would I go spend, why do you charge $100 for a drill? Well, when you don't understand the why, you're going to get more objections. When the patient doesn't understand the condition, you're going to get more objections. So the first thing I'd say is prevent objections. Don't get them. But if you do get objections, make sure that you know how to handle them. You ask a question. You soften the blow. So we do listen, cushion, and question. Somebody says, how much is that going to be? Oh, just like I did with Virginia, right? Oh, we'd be happy to figure that out with you. Let me ask you this. If we could figure out how to fit this into a budget and work this out with you, do you feel like this is the right plan for you? Now, what you're going to hear as dentists is, do I really need this? Do I really need to have this done? You might have heard that already. Do I really need this? Now, is that an objection? It's a potential objection. It's a question for now. And you might say, well, that's a great question. I think it makes sense. Let me ask you this. What is defined by need? What will have to happen for you to feel like, oh my gosh, I absolutely have to do this? And they'll say something like, oh, if it hurts. Okay. So once it hurts, you could wait until then, and we would do a root canal and then the plan. Or we could do the plan now and prevent the pain and prevent the root canal, whichever you'd prefer. So listen, cushion, and question. I hear where you're coming from. I get it. We all have to be careful on how we budget our money these days. Let me ask you this. Are you concerned about total cost or fitting into a budget? What's more of a focus for you? And they'll give you some direction. You can have a conversation with them. But you have to be willing to engage in that conversation. As the business owner, at some point, all the pressure will be on you. All the risk is on you. You have to lead your team by example. They have to hear you use these verbal skills. They have to see you lead in a way that's successful for them to ever buy into doing it themselves. What you can't do is sit back and go, oh, I'll have a team that'll do that. They won't. They're human beings. They won't do it unless you do it. They want to see you do this. Some of you might say, well, I'm going to be an associate. I won't have to do that. Same patients asking the same doctor the same questions. So I don't know, Dr. Harrison, did that answer your question?
Yeah. You guys have any questions?
Yeah, feel free. 15 minutes of free access to coaching and consulting.
You got a question?
Yes, what is it?
You kind of already said this, but do you think it's beneficial to have your hygienist and your assistants doing a lot of the conditioning and you present the treatment?
So it's actually both. I just got off with a call with a doctor in Benicia, and she has a new hygienist, and she had her shadow her veteran hygienist to watch how the hygienist sets the doctor up when the doctor walks in the room. So if I were to do that, I would say, doctor, I'm the hygienist. Dr. Smith, Ricky Bobby and I were talking. I have some photos up on the screen. He and I are both concerned about the 2 teeth in the upper right that have old metal fillings and fractures. He understands that I'm concerned about helping him prevent a broken tooth or a toothache. And he wants to talk to you about how to get that taken care of. Right, Ricky Bobby? Shake and bake. Now, what you can't do is go, oh yeah, those need 2 crowns. Right? You got to continue that conversation. Oh yeah, this makes sense that you'd be concerned about it. I'm concerned about it too. Would it make sense for us to talk about a plan? Yeah. Okay. Here's what we would do. We'd remove this. We'd take care of that. We'd bond this. We'd restore that. How do you feel about moving forward with that plan? Sound good? Okay, great. And then Ginger, your hygienist, because gingivitis, right? Ginger, your hygienist, will then take it from there. Okay. Does that answer the question?
And that's a perfect example of something that I know Eric teaches as well, but is as a pass off, or maybe it's another term that you use, but
transfers.
This information that has to occur when somebody else new comes into the room. So
Yes.
your hygienists have had this conversation now for the last 30, 40 minutes with the patient as they've been cleaning their teeth.
Yep.
And now they have to transfer that information to you so that you can come in. And it's the same way when they go to the front desk to transfer that patient to the front desk to get them scheduled.
That's
Eric,
right.
what would that look like? What would that
Yeah. So keep in mind, we go back to 95, not the 5. So hypochondriacs in the room, prepare yourself. So when we walk the patient back out to the front, we go back into condition. We do it privately or semi-privately. We don't, blast people's personal information over the reception area. I say, Virginia, I'm the hygienist. I say, Virginia, Ricky Bobby and I were talking, and when Dr. Harrison came in, all 3 of us realized that we have the same concern with the 2 teeth in the upper right. I've written down what the plan is. I've printed that out for him, and he is really concerned about making sure we save these teeth and preventing any sort of breaking or a toothache or anything like that. Right, Ricky Bobby? Yeah, okay. It's really important for him to have peace of mind knowing that he's not going to lose his teeth like his grandfather did. Again, it's a private area where you can have this conversation. So I'm empowering the next person in line to hear that conversation. We call that transfer of care. Yeah. We systematize everything. Every verbal skill we use, we systematize it. We don't script it. We systematize it so that if I say, hey, remember to use your permission statement, you know what that means. Remember to use over here psychology, eliminate limiting terms, use your case presentation formula, transfer of care. These are all things that we use so our clients can say, oh yeah, I know what I'm supposed to say here to get comfortable with this and work on repetition with it. Yeah, what else?
Yeah.
Any other questions?
Yes.
I think this is more of an issue maybe here and hopefully not when I'm practicing, but we get in the middle of treatments and then something goes south that you didn't anticipate. How do you have the conversation of the next steps and whatnot to push them to do what's right rather than back out completely?
Am I understanding correctly that you think it's going to be a cavity with a filling and it turns into a root canal and a crown?
Yeah.
Okay. Always prepare for the worst. So if you're looking at a tooth, and this is for, I'm not a dentist, I don't even play one on TV. I have no idea. Here's what I hear from my dentists who have been practicing for 40 years. 99.9% of the time when they remove that metal filling, guess what's underneath there?
Okay.
Decay. And guess what's right at, it doesn't want, that decay does not want to expose the pulp, right? It doesn't want to do that because then it calls attention to it and its life is over. It's playing survival mode too. So what you tell the patient is that you say, look, here's what we find every single time we get behind this lead wall that we can't see through with x-rays because it's a lead wall, it's a metal filling. We get underneath there and there's decay just pulled up at the bottom and it's doing everything it can just to eat away at the tooth without exposing the nerve of your tooth. It's actually created its own wall to the nerve and it works like insulation. We cannot leave any decay there. So if we get in there and we remove that decay and it has already eaten through the last barrier and exposes the nerve, and we'll see blood if that's the case, then that means we're too late. That the toothache was coming, it was just a matter of time. We have to get the decay out, and now there will be a toothache. That's how deep this is. That's how concerned I am with this. Better to go now and address it at the chance of not having a toothache and not needing a root canal, and hopefully restoring it with a filling. If that's what we can do, that's what we'll do. We're going to let you know what both options are going to be, and we'll decide when we go in there. It's going to be like exploratory surgery. We're going to figure it out right when we get there. And now you've prepared them for the worst. And if it's not, oh my gosh, you're a hero. You will find you're going to go in, you're going to do buildups and crowns. And some are going to be great. And then they're going to come back and they're going to have sensitivity. And you're going to think, oh, I just need to adjust their occlusion. And they're going to have pain. And what happened was it was just too deep, right? Yeah. Hopefully that helps you.
Yeah. So I realize now that you guys are going to still spend the next 5 years trying to figure out how to do dentistry. I promise you from experience, that will all settle and you'll be able to do dentistry very well and you'll do what you like and you'll not do some of the things that you don't like. But what will happen is that's when you'll come back around and realize a lot of the things that Eric was talking about, and maybe one or two of the things that I've been talking about are so key and so important. And so just remember that. I want that light bulb to go off and say, oh, Dr. Harrison said this was going to happen to me. And people like Eric and his coaching team are there for you. They're great just to help guide you through this. You guys don't realize now, most of the patients, all the patients that come see you here need something, right? They know they need something. That's why they're here. When you're out in Eastern Jefferson County or in other communities throughout the world, your clientele is going to be a lot different. And so some of these verbal skills and these things that we're talking about are going to be things that are going to really help you and help you to be successful in your practice. So that's my little soapbox. I'll get off of that. But
love it. No, it's
Eric,
so true. So true.
Thank you so much for being here with us today again, Eric. Appreciate it.
Absolutely. Thank you guys for having me. Have a great day. And I hope to hear from you guys in the future and how successful you are.